Duodenal switch. Duodenal switch. A bariatric surgery designed to treat people who have severe obesity, to lose excess weight and reduce the risk of potentially life-threatening weight-related health problems. It is the most effective bariatric surgery, especially effective against type 2 diabetes with a BMI greater than 50. It works with effects of restriction, dumping, reduced appetite, and malabsorption. The average weight loss with this surgery is 80% of excess weight over a 2-year period. As much as 90% of people with type 2 diabetes are able to discontinue their medications after a duodenal switch. Some people who fail to lose enough weight with other bariatric surgeries choose this as a revision surgery. Examples of potentially life-threatening weight-related health problems: heart disease, hypertension, hypercholesterolemia, severe sleep apnea, type 2 diabetes, stroke, infertility. Steps. Aims. 1. Sleeve gastrectomy. For restriction of food, the individual can take in an decreased production of ghrelin, hunger hormone, that is secreted by PD-1 cells in the fundus. 2. Intestinal bypass. For restriction of calories the body can absorb by limiting the time food mixes with digestive juices. The bypass is performed further down the small intestine compared to the Roux-en-Y gastric bypass, RYGB. Types of method for intestinal bypass: biliopancreatic diversion with duodenal switch, barrel of oil per day per decisecond. Sleeve gastrectomy. The beginning of the duodenum is cut and stapled, and the ileum about 300 centimeters. Depending on the patient's, from its end is cut. The biggest part of the intestines is bypassed, and only the most distal piece is reattached to the stomach. The bile and pancreatic juices are only introduced into the intestines very late in the digestion process. Modified, loop, duodenal switch. SADI-S, loop DS, sleeve gastrectomy. The beginning of the duodenum is cut and stapled, and the pylorus is then anastomosed to a segment of the ileum about 250 to 300 centimeters from its end. Potential adverse effects. Treatment: vitamin and mineral deficiencies. Supplements that contain vitamins and minerals. Protein malnutrition. Daily protein intake of 60 to 120 grams, 1.5 grams per kilogram ideal body weight, from food or protein supplements. Stearia. Limiting the amount of fat in the diet. Taking pancreatic enzyme supplements.